We had suspected that once the rule on price transparency in healthcare was finalized, hospitals would sue. Well, the rule is finalized, and hospitals have now filed suit against this rule. The final rule that we're talking about is the rule that directs hospitals to make their standard charges public. It's distinct from a proposed rule that is still on the books about transparency in coverage. But the final rule we're talking about today is the one that's talking about price transparency in a hospital setting about getting standard charges when you're seeking care. This comes from a June executive order signed by President Trump that directed the Department of Health and Human Services to put some regulations on the book to require hospitals to post standard charge information. It has to be done publicly. It has to be done in a consumer-friendly format to increase the availability of meaningful price and quality information for consumers and for patients. So they issued the regulation. It was proposed earlier this year. In November, it was finalized. And as of December 4th, hospitals have sued. The final rule, in its essence, would require hospitals to provide patients with what they call clear, accessible information about their standard charges for the items and services that are being provided. It really makes it easier for consumers to comparison shop across hospitals and across hospital systems. The effective date for the rule is not until the year 2021, but hospitals have taken action right away to make sure that doesn't happen. The lawsuit, like we said, that was filed December 4th, it was on behalf of both hospitals and hospital groups that have sued the Trump administration, hoping to block the rule. It was filed in the U.S. District Court in Washington, and it includes groups like the American Hospital Association, Association of Medical Colleges, National Association of Children's Hospitals, and a couple individual hospitals also joining the lawsuit. They're saying that the administration exceeded its legal authority by creating this rule. They say it violates the First Amendment rights of the hospital, and they simply just don't want to make public things like payer-specific negotiated charges and the maximum and minimum negotiated rates for what ends up being over 300 common shoppable services. And by shoppable services, we mean things like x-rays and labs. So this is ongoing. This is that hospital price transparency rule that's being litigated right now. We will bring you updates as we get them about this lawsuit, but at the same time, we're going to keep our eye on that proposed rule on price transparency in coverage that's impacting more of the health insurers and plans out there. Once that gets finalized, which should be in the next couple months, you can bet that maybe the insurance companies will file suit on that one as well. So as consumers try to get a little bit more information about fair pricing in healthcare and coverage, we have the industries going up against that. So this fight will continue. You can read the complaint in this particular lawsuit. We link to that in the description below. And we also remind you of what that final rule looks like. That's also in the description below. To make sure you stay up to date on those lawsuits and those rules as they're finalized, make sure you like this video and subscribe.